today with another episode. We have a very interesting thing on the board. It looks plenty, but then it's going to be very simple. Um, we simplify things over here. You understand? All right. So before we get into it, believe me, I mean, there is going to be changes to the name of the channel as to from O.M.A Medical Studio to another name. So basically, in our subsequent videos, if you happen to see that the name has been changed or the name has changed, please try to just bear with us. We are trying to find a name that is more user friendly, that is more accessible, that's more simple to look out for. So I mean, having a lot of questions to answer concerning what the O.M.A means. That's the initials, what it means. I mean, it's my name, but then it has another thing attached to it. So basically, we are going to try to make changes to the name. So in our subsequent videos, if you come across that, just don't be surprised. I mean, this is the update I'm giving you. All right, so let's get into it. In our earlier episode what concerning normal menstrual period, we realized that normal menstrual cycle should actually has an average of what 24 to 38 days. I mean, almost every female has that kind of that number of days for a normal menstrual cycle. That's the period to go through. All right, and then we also talked about the fact that the number of days one should bleed shouldn't be more than 8 days. And within those 8 days, we also emphasized on the fact that one is not supposed to lose more than 80 mils of blood. That is to say that you shouldn't lose more than a blood level that is equivalent to about 5 teaspoons. I mean, we all understood that in our earlier video. That's if you have watched. So those who haven't watched, please do what to watch. And please, when you watch it, try and what subscribe and share to other people who also have what access to this particular knowledge we are all what sharing. All right, so we also came across another thing where we discussed that for normal menses, it's normal for someone to have what, or it's normal for a female going through a menstrual cycle to experience pelvic cramps, which basically can affect the lower back as well. So pelvic pain, lower back pain is normal. But then the point where this pain affects you to a level where you are unable to carry out your daily activities, that is basically where the problem is coming from. So basically today, that's what we are going to have our discussion based on, right? Painful menses. That's with this big term here. I didn't want to mention it, but then once I'm pointing to it, I mean, if you can see the arrow, the arrow, the pointer on it, you should see that's dysmenorrhea, abnormal or painful menses. So basically, when the normal pain you should go through at a particular point in time or in your cycle is giving you that kind of level where you are incapacitated or you are unable to carry out your normal activities you used to do, then it basically means you are going through a very painful menses. So that is to say that you are having what a dysmenorrhea. Now the question is, how do you get to know that this particular pain I'm going through or this particular pain I've been going through is what dysmenorrhea or is consistent with what dysmenorrhea? That is where the question comes in. So please let's pay attention to what to this particular episode. All right. So we say dysmenorrhea is one of the most common causes of cyclical pelvic what pains that occurs at predictable intervals. In the sense that within every cycle, within every month of the woman's cycle, that is when the woman is about, or when the female is about to have her menses, there is pain to a point where she can't control. She has to what? To do something about it. She has to visit the hospital with it. That means that the person is going through dysmenorrhea. And I guess, I mean, at this point, you all understand what dysmenorrhea means. The problem is really not for me, the problem is really not the pain here, but then what can we do about it? How does it even happen? You understand? If we get to know how it occurs, we get to know the possible causes, then we can possibly know how to what, manage it. Because day in day out, we have people or we have females who come out and you see that they are going through a lot of pain, but they tell you that they don't want to take medications for it because they don't want to get addicted to the medications or to the painkillers. So they want to endure. We have people like that. But pain is a bad thing. If you have about 20 people coming to hospital each day, trust me, about 17, 16, 17 of them are coming because they are in pain. So please, let's not joke with pain. Pain is a very serious thing we need to address. So people who wants to endure pain, sometimes I feel really scared for them. Pain is not a good thing. You understand? All right. So not to talk plenty. So we've had a little briefing on the earlier one we did, and then now we've gotten to know that dysmenorrhea is what it simply means of painful menstruation, where the level of pain makes you incapacitated to your daily or your usual activities. What are the types of dysmenorrhea? Types of dysmenorrhea. All right, so we can have a dysmenorrhea that's a painful menstrual cycle. Normally, 80% of women will feel like the pain is normal. I mean, they've always been going through it, so it's normal. You understand? But most of this pain can be caused by a lot of things that we are not aware of. If you don't, I've seen several of them where sometimes they even question you that they even come into disagreement with you that no, they've done a lot of lab, they've done a lot of scan, there's nothing they are finding. They said everything is fine, only for you to find out that there is something there. You understand? So we have what we call the primary dysmenorrhea, we have what we call the secondary what dysmenorrhea. Our focus today is basically going to be on the primary dysmenorrhea. I mean, as you can all see the point down, that's where our focus is going to be. Then we can, but before we get to it, I'll just highlight some few causes of secondary dysmenorrhea. When we say a primary dysmenorrhea, it basically means that the painful menses you are going through, the painful cycle you are going through, the pain that is giving you no rest when you are about to have your menses has no identifiable cause. It means there is no cause to it. It's just the physiology of your body trying to give you that kind of headache. Then we have a secondary dysmenorrhea that has an identifiable cause. So if you are going through a lot of pain during your menses, and possibly maybe you've gone to hospitals already, you've gone to clinics already, you've even gone to the point where you've done herba, you are not finding any possible cause. Maybe you should try to revisit the hospital frequent times for labs to be to be done. Maybe if at that point nothing was detected, maybe at this point you can find something. Not to sit there and say, I mean, it's normal to go through the pain, so I have to endure. All right, that's just by the way. All right, so when you talk about this secondary dysmenorrhea, it basically means that painful menstrual cycle that has what painful menses um that has what an identifiable cause. Some of the causes can be what you call, I mean, these terms are kind of I don't know whether to say big, but then yes, we have what we call endometriosis. That's what abnormal growth of cells outside what the uterus, outside it. Then we have adenomyosis. We have what fibroid, we have polyps, we have what pelvic inflammatory disease. I mean, we have a lot of things causing what that can lead to what secondary dysmenorrhea. That can give you that level of pain you go through in your menses. Like I said, I'm not going to be very much focused on this for today. So yeah, this is where the focus is going to be on. What since it has no possible or identifiable cause, it means the causes cannot be identified. If you take a scan, it's normal. You do all the labs you want to do, everything is normal. That's where we arrive at what? Primary dysmenorrhea. And I'm saying that dysmenorrhea is cyclical and it occurs at predictable intervals, which may be known or unknown. So the person may come and tell you that I've been going through this. If you are a physician, if you're a clinician, if you're a nurse, if you're a health worker, the person will come and tell you that I've been going through this every month. But for this particular month, can't take it. For this particular month, it has been more severe. We are going to look at the causes for all of these things. All right. So we have one of the reason someone may be going through that particular level of pain is basically what? One is what? Early menarche. Menarche is that's definitely the first menstrual period of the female child. You understand? Early menarche, when right now things are changing. First, I think menarche first we used to have like 15, 16, but now people are even having their menarche at the age of 9, at the age of 8, at the age of 10, 11. And early menarche is because sometimes these people are not prepared. Mentally, they are not prepared. These early children are not prepared mentally. We are in a society where we don't prepare these female children as to how they should um, get used to the fact that they are going to go through this period of, they are going to go through a certain period where these things will happen to them. So when it comes, this is how they should deal with it. Mentally, they don't get prepared. Emotionally, they are not prepared. So when it comes, even the pain that is supposed to be normal will be what? Abnormal to them. All right. Then we have what we call the longer menstrual period. If you have someone who has a menstrual period, that is a bleeding period of let's say about 3 to 4 days, compared to someone who has a bleeding period of more than even 8 days or even up to 6 to 8 days. If those two are going through pain, you realize that the one having the longer periods will experience more pain than what the one having what the shorter period. And we have people with what? High BMI, body mass index. The obese. There is a level of what? Pain due to sometimes the high fat levels and all of that. Smoking can also lead to that. Parity. When we say parity, basically means the number of birth of that person. How many times that person has what? Giving birth. If you have been able to go through labor pain, I don't think menstrual pains will be an issue to you. So people who have not given birth before are likely to suffer from dysmenorrhea compared to people who have given birth before. That's as simple as that. If you have been able to go through labor, I mean menses shouldn't be menstrual pain shouldn't be anything. Not to say that people who go through who have given birth, you can have people who have given birth to like 9 children and they will still have what excess level of pain that they can't even control. You understand? So that's another way. So this is it. Types of dysmenorrhea. So we have what we call the primary dysmenorrhea and what secondary dysmenorrhea. As I said earlier on, primary dysmenorrhea basically has no identifiable cause. Where secondary dysmenorrhea has what? An identifiable cause listed under them. The endometriosis, adenomyosis, fibroid, and what have you. Now my question again is, how does dysmenorrhea occur? How do all these pain come? What what triggers them? What are the hormones involved? What are the substances involved in this period? Why should there even be pain? You understand? All right. So with the reproductive tract of a female, last time it was on the board, we realized that there is a cervix, that's the gate to the uterus. There was a uterus. The uterus has what? About 3 layers. You understand? So we have the inner layer of the uterus and what have you. I'm not going to spend my time on that. Alright, so this is what happens. Once you go through the follicular phase, that's before the egg is released, realize that before the egg is released, there are a lot of hormones that are high. Estrogen is high, progesterone is high, all to prepare one to receive what? Something. That is to say, to receive a fertilized what? Egg. So for the point to a point where the person doesn't get sperms to fertilize the egg, it means that the body will give up in what? In that preparation. If I'm preparing towards a program and then midway to the preparation I realize that the program is not going to happen, what will I do? I'll stop the preparation. So the high levels of the estrogen and the high levels of the progesterone will start going down. Now, when they start going down, the uterus that has been prepared will start what? Breaking down. The inner lining of the uterus will start breaking down. When they start breaking down, what we call the prostaglandins will be released. Once the uterine lining starts breaking down, prostaglandins will what? Be released. Now, these two hormones, estrogen and progesterone, they play a very important role when it comes to prostaglandin levels, in the sense that estrogen here increases prostaglandin levels, whilst progesterone here what? Inhibits the function of what? Prostaglandins. Now, progesterone will decrease where there is no fertilization. Progesterone production will decrease where there is no fertilization. Once, even though this one is going to decrease, but progesterone is supposed to come and what? Inhibit what you call the prostaglandin. If it's supposed to come and inhibit what is called, if it's supposed to come and inhibit prostaglandins, and then it has decreased in production, where prostaglandin release also comes from the uterine lining breakdown, it means that we will not have anything blocking the activities of prostaglandin. And this is what prostaglandins are going to do. They are going to what? Cause the pain. The pain we have been going through during our menstrual cycle, prostaglandins are the ones causing it. And what happens is that this one has declined in production. That's progesterone has declined in production. So there is absolutely nothing blocking it. And another factor that can increase the levels of or determine the levels of amount of prostaglandins that are produced has to do with the thickness of one's uterus. If you have a very thick uterus, prostaglandins are going to be very high. So people, that is to say that people who have thick uterine walls or thick uterine muscles are going to go through higher pains than people during their menses than people with what? With smaller levels of what? Thickness. So this is basically what happens. So anything that you take into your body that leads to prostaglandin release can eventually lead to what? Higher menstrual cycle, especially when you are in a space where when you are in a period of your menstrual cycle. I mean, this is as simple as I can put it. I hope you all get it. This is as simple as I can put it. So just know that prostaglandins plays a role in your menstrual pain. Estrogen plays a role, progesterone plays a role. Progesterone's role is to block it, but because it has declined in production due to the fact that you didn't allow any sperm to fertilize your egg, so you have to go through pain. I mean, that's your punishment for dodging the pregnancy space. All right, so we have other factors that can also contribute to your pain or contribute to our pain. I'm not a lady, but then that's just by the way. Caffeine. At a point, a lot of research are saying that caffeine also kind of limits the blood flow to your uterus, causing pain. Alright, so when all these things, when all these prostaglandins are produced, this is what happens. Prostaglandin causes contraction of the uterus. Now the uterus is shedding off. There is something it has to contract to bring them out. These contractions leads to a lot of pressure on the cervix. And the cervix, the reason why, that's where the pain comes from actually. The reason why you go through a lot of pain when it comes to that, when there's a lot of pressure on the cervix, is that the cervix has a lot of nerve endings. Nerve are things that gives you the sensations, pain, touch, anything. Understand? The cervix there has a lot of nerve endings. So it's very sensitive. So there's a lot of pressure on the cervix that eventually what gives you what? The pain. So prostaglandins will cause contraction of the uterus, the contraction of the uterine muscles will eventually put pressure on the cervix that will eventually react and then come out as well as pain. These are the other factors contributing to it. A lot of caffeine intake can lead to what? Menstrual pains, that's severe menstrual pain. Heavy alcohol consumption can also lead to that. Then what? High sugar intake can also lead to that. Then we have what? Spicy food. I mean, I've come across people or clients who would say you won't take spicy food, you won't take I don't take in sugar sometimes than malt, sugary, those sugar drinks. You don't take it. when they are in their menstrual period, because they tell you that you will go through pain. I mean, these are evidence that when you take in these things, there is some sort of what um prostaglandin trigger, or there's some sort of pain that is going to happen. Either they are limiting blood supply, or they are kind of helping to facilitate the release of what prostaglandins. So all these things can what contribute to your menstrual pain that will incapacitate you to what to your daily what activities. The interesting part here left is how to manage it. Like I was saying earlier, some people will say, I won't take anything, I would endure. You can sleep in the room, be in pain, cry, 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 cry. Why? When you can take a painkiller, who said you are going to get at it? I mean, if you are taking two painkillers, you are taking about two episodes of painkillers. I mean, you are talking about addiction. Meanwhile, if you are in pain, if something happens to you, probably maybe you I mean, this is lack of better example. That's what I'm using it. If you find yourself in a trauma or an accident where you are going to be in pain for like several years, are you going to tell me that because of addiction you are not going to take the painkiller? I mean, come on. You can't be enduring pain like that. Manage it. Just try as much as possible to manage. There are so many ways to manage pain. I mean, non-pharmacologically, that is to say you are not using any medication. Then you can get a massage. I mean, of late the economy is so hard. You will not even think about going to lie down for someone to massage. You don't even have time for that. All right. Then you have a general exercise. I mean, you can be exercising to a kind of also inflict pain on the pain. Then dietary adjustments. When you are consuming all of these things, caffeine, heavy alcohol consumption, high sugar intake, spicy food, you can what make adjustment to it, since it has direct and indirect what contribution to painful menstruation. Then we come to what the use of medication. What do you think the medications are going to the type of medications to manage dysmenorrhea or manage painful menstrual period? What do you think? Pause. You can pause the video for like a minute and try to answer. All right. So you learn that the medications we can use are medication that should focus on this prostaglandins, focus on the very cause of the pain we are going through. Indirectly, you can look for medications that are going to improve progesterone release. I mean, come on, it's not something you want to do. Or basically, you are going to look for medication that's going to block estrogen, which you don't want to do. Right. So one of the things we can target, or the very thing we can target, is what the prostaglandins. And the medications for targeting prostaglandins are very, very, very common. They are called the over-the-counter painkillers. You go to the drugstore, I want Jibidol, I want ibuprofen, I want diclofenac. All are what we call the non-steroidal anti-inflammatory drugs. So those are the NSAIDs, the painkillers. They primarily target prostaglandins. Then they eventually what reduce the pain. That's it. So that's basically the work of the painkillers we do take when it comes to what painful menstruation. But one of the side effects is that, I mean, this is I'm just chipping in this. When you take a lot of these non-steroidal anti-inflammatory drugs, example ibuprofen, diclofenac, Jibidol, all of them, they block prostaglandins and then they give you the pain relief you want to get. Now another thing is that these prostaglandins, when it comes to your stomach, they produce a wall that shields the stomach lining from the effect of acid. So the longer you take NSAIDs, non-steroidal anti-inflammatory medications, the more you reduce the protective layer of your stomach. So at the end of the day, if the stomach acid is produced, it kind of gets direct contact to your stomach lining, hence burning it. giving you that kind of ulcer symptoms, abdominal pain. That's more of your upper abdomen pain there. So eventually, if you don't take care of it, then eventually you suffer from what you call ulcer because it will give you sore. So this is dysmenorrhea, abnormal painful menstruation. So we are spoken about the fact that we have two types of dysmenorrhea. We have the primary and then secondary, where the primary has no identifiable cause. The secondary has what possible causes. We went through the possible causes and we spoke about how prostaglandins leads to what menstrual pain. The fact that it causes the uterus to contract, which puts a lot of pressure on the cervix, hence leading to what pain because the cervix is very sensitive and it's enriched with what high nerve what endings. We spoke about other contributors to what menstrual pains, that's caffeine, heavy alcohol consumption, high sugar intake, spicy food. And finally came to the management. There we can go to have massage. That's if you have the time and the money. You can have your general exercise done. And you can adjust your meals and then medications for it. And last but not the least, if you do all of these things and it's not going, please kindly go and see your physician. For all you know, it may be secondary dysmenorrhea. So please don't just sit at home and be taking painkillers just because I've told you that these things will control them. Even if you have secondary dysmenorrhea, NSA should be able to give you some form of relief when you take them. But then that is not to say that that's all. Get to the hospital, get tested, get screened, do all the next possible things you will do to rule out any possible cause of your painful menstrual cycle. This is O.M.A Medicals to you. Tune in again next time and trust me, you are going to love the next topic we are going to do. Thank you.